What's up, everybody? Dr. Rossi, shrinksandSneakers.com. I've been doing a lot of videos recently about lifestyle modification, and one of the ones I really want to talk about because it's so important in mental health, it's so important for your physical health, and that is sleep. Now, I don't want to talk about sedatives and hypnotics and medications just yet. I want to start out with what I would tell any patient who comes in who's having a problem sleeping. And we call these things sleep hygiene or sleep hygiene techniques. And I've gone through and made sort of a handout that I would give to any of my patients, and it helps them to kind of work through it. And I think it's useful to go through it here because a lot of the things I talk about in this handout are the same things that I would recommend to anyone who's having difficulty sleeping. So, sleep is powerful. It enhances your mental health. If you do these techniques, or if you use these techniques on a regular basis, you're going to be sleeping better, and it's going to help when in combination with medication. So if you are taking medication, then this is going to work better or even possibly enhance the effects of medication if you're already on it for sleeping purposes. And by investing this time, you're learning these skills, and they're going to benefit you long term. Like I always say, the psychosocial interventions, whether it's psychotherapy, whether it's sleep hygiene, these things are going to carry through for you your entire life. So it's not just a medication you're taking for a period of time. This is going to continue to be useful and beneficial to you throughout your life. So what I do is I usually go through this with somebody, and I would kind of explain each part, and then I would ask them, are you doing this already? Are you willing to do this? And is there any specific barriers to potentially implementing this? The first thing I always recommend is that people stick to a routine. Routine is king, and routine is especially important if you have bipolar disorder. And what I mean by that is you want to wake up at approximately the same time each day, and you're going to do this for 7 days. You don't want to alter the time on weekends. Sometimes people feel like when they have more time to sleep, they should sleep longer. It's a bad idea. Much better option is to just continue to wake up at the same time, even on your days off. And what this does is this sets your circadian rhythm or internal clock, and you have more control over your sleep and wake times. And one of the best benefits of this is I also recommend that you avoid taking naps throughout the day, right? We don't want to be taking naps throughout the day. We want to make sure we're getting good, healthy sleep at night. So setting a regular sleep time, regular time to go to bed, as well as a regular time to wake up each day is going to be a really good idea. The second point that I usually talk to my patients about is to avoid caffeine after a certain time. We all love caffeine. I love drinking coffee myself, but we don't want to drink too much caffeine too close to the time we're trying to go to sleep. So set a time of 12 p.m., but I would say no later than 2 p.m. If you work a job where you really need that afternoon boost, okay, fair enough. But I would say 12 p.m. should be your cutoff, and that's because the effects of caffeine can linger, they're long-lasting, and they can interrupt sleep. If you can't completely stop caffeine, you want to minimize your consumption and have that consumption before 12 p.m. if possible. The third point that I always make to my patients, and I think this is great for anybody, is that you should be exercising daily, 7 days a week if possible. And you want to preferably do that exercise earlier in the day and not too close to bedtime, because exercise can be activating, it can make you feel good, and it can keep you awake at night. So while I want you to exercise, I want you to do it earlier in the day. And you could start with as little as 15 minutes per day and gradually work your way up to higher and longer sessions. And you should probably be doing a combination of both resistance training and cardiovascular training. If I had to choose one due to time constraints, I think cardiovascular training actually has more bang for its buck when you're talking about mental health and improvements in your mental health. Number 4 is to stop doing active mental work at least 1 hour before bed. So active mental work could be reading and responding to emails for work the next day, reading a book, doing a project. You really want to just give your brain a break an hour before bed. Don't read too many things. Don't add a bunch of stuff to your mind. Number 5 is to avoid watching TV or using a smartphone, laptop, tablet, etc. in your bed. So the bed, you want to make an association in your mind that the bed is for sleep only, right? And when we watch TV, when we use our cell phones in bed, the blue light from the screens actually has been shown to worsen sleep. Now they do make blue light blocking glasses that you can buy, but why go through that process? Just put the phone down. It's much easier, right? So again, bed should be used for sleep and sex only. Number 6, we want to create a bedtime ritual, and this can be helpful for people. Again, routine is king, and every night before bed, you might take a warm bath, do a mindfulness exercise, do a gratitude journal entry, read a little bit, an hour before bed, of course, right? Or listen to some music that's calming and relaxing. So create a nighttime ritual that gets you in the mood to sleep, right? Get you in a place where you're ready to fall asleep. Number 7, do not use alcohol as a way to promote sleep. Alcohol does not help with sleep. It actually changes the sleep architecture and makes your sleep worse over time. So studies show that there's plenty of negative impacts on the sleep architecture, and you might get some additional sleep, but it's going to be unsatisfying, unrefreshing sleep, and you're likely going to wake up feeling tired anyway. Number 8, we want to make sure the environment's conducive to sleep. So how do we do that? We create a dark, quiet, temperature-controlled room that's cool, but not too cold. The recommendation is ideally somewhere around 65 degrees for the room when you're sleeping. You can consider purchasing things like blackout curtains, a fan to cool the room, earplugs if you need that, or a facial mask to cover your eyes if you prefer those kind of things, but anything to make the room cool, dark, and quiet. Those are the big things. Number 9, you're going to want to restrict food and drink intake about 2 to 3 hours prior to bedtime. This will reduce the chances of your sleep being interrupted by something like having to use the bathroom. So restrict your food and drink intake, stop 2 to 3 hours before bedtime. If you have any pain, take any type of appropriate pain medication prior to bed. So if you have chronic pain or you have an injury that occurs that's going to keep you awake, you want to make sure you're treating that pain prior to trying to fall asleep. Now, those are my 10 basic things that I go over. There's other sleep hygiene aspects that we could address as well, but I think those are the ones that are most important for getting quality, restful, refreshing sleep every night. And if you're doing these things majority of the time, and I would say majority of the time means about 90% of the time, you're going to feel better. Some of your psychiatric symptoms are going to improve, and you may not need to take medications to help you fall asleep at night. So I think there's a lot of benefit to working through these sleep hygiene techniques and implementing them in your daily life. I'm going to cut the video there. I want you guys to ask any type of questions. Please drop them in the comment section below. I'd be happy to talk more about sleep hygiene and how I implement it in my daily practice. And also, please like and subscribe to the channel so we can continue making videos just like this.